I'm Travis Whitley. I graduated from perio residency in 2016. Probably about a month after I graduated, I got trained on LANAP. Very satisfied, and my patients love the service that I can offer them. I was first interested, or I guess exposed to LANAP at the practice I joined, probably my second or third year of dental school. It really fascinated me just because I'd never heard of it, and then once I started getting exposed to the periodontal surgery and other techniques to treat gum disease, I just kind of felt like that was something that was very predictable with the doctors that had been using it at our practice. Patients were a lot more comfortable afterwards, and so part of it was the practice that I joined already had the laser. After going through the residency and kind of learning more about different treatment options, I felt like that was the best option for the patients. So I felt like the laser was able to achieve a lot more of those patient outcomes in a more predictable and satisfying way compared to the traditional methods. The LANAP protocol, I feel like, has the potential to be a very predictable and successful treatment modality for years to come. I think, again, the LANAP protocol, it's a lot more comfortable for patients. They're having less post-operative comorbidities, less pain, sensitivity, and I think that's important to patients. They want to come in and have treatment that's going to be comfortable for them, and they don't want to be put out of work for several days to recover. And I feel like that's important, but it's also being equally successful or predictable compared to conventional methods. I had a patient, he was in his late 40s or early 50s, a gentleman who had been referred to our practice for extraction of a lower incisor. And he, his dentist thought it was a hopeless situation, and I started talking to him about it and said, we have this laser that a lot of times we can treat hopeless teeth, and long term it might not be a tooth that you'll be able to save for the rest of your life or keep. You might have to have it removed and replaced at some point, but we can at least try it and see what kind of results we get. And he was on board with that, and we were able to keep the tooth, got it stable, and it was a lot more comfortable for him. He was having a little bit of discomfort with it initially due to the mobility of the tooth. He was just thrilled to be able to keep his anterior tooth, because aesthetically he didn't want to have to deal with missing that tooth for any length of time. So he was very satisfied. A big part of our practice is we are referred for a lot of implant complications, periimplantitis, malpositioning of implants. So a big part of our practice is treating ailing and failing dental implants and other complications. So I have treated probably 4 or 5 cases that come to mind, and patients, again, were very pleased with the procedure. It was a very quick appointment, very comfortable for them, no post-operative pain, and they still have the implant, and it's stable, and something that it's a great service to patients that we can offer. I think it's a great instrument to be able to have in your repertoire of things to offer to patients. It has been my go-to, and I feel like that if you did not have that, it would somewhat cripple you as a private practice periodontist, wherever that may be, just because a lot of people are getting more educated. Patients know about the LANAP protocol. They're asking, do you do the laser? Are you a clinician that practices using the laser? And I think dentists are becoming more educated about it. And so I think that's just one thing that you can do to set yourself apart, and also provide a good service to patients. Because I would say probably half of the procedures I've done the past year being in private practice has been laser or LANAP treatment for periodontitis. So it's a big part of my practice, and it's something that I would highly recommend they get trained to do.